So I work at Health Resources in Action. We're a nonprofit public health organization in Boston, based in Boston. We work nationally. I also direct the Asthma Regional Council, which is Region 1. Actually, it was brought together by HHS, HUD, and EPA, which is kind of resonant with this conference. Back in 2000, we worked on lots of different issues, and we've been chipping away forever around the issue of sustainable payment systems for asthma home visiting. So actually, I'm really going to be talking about promoting sustainability for community health worker led asthma home visiting and how we've engaged Medicaid payers. Who here has tried to engage payers or is engaging payers or wants to engage payers? Some hands going up. Okay. So I'm just going to tell you about our project. This is a slide I have to put up. We were actually funded one of the CMMI Healthcare Innovation Awards in 2012. We got $4.2 million. And before I start this, I want to say this is like my favorite quote. This should be tweeted all over the place. Harold Miller worked on healthcare reform issues. Joe, you were at the conference where he said this. I think it's really funny because payers, and this might soon transform to ACOs as well, they're thinking, show us the evidence, show us it works, show us the numbers, show us return on investments, and providers like, it works, we're making people healthier. I tend to be from Venus, but I'm trying to be somewhere between Venus and Mars. And actually, I have to say, I feel frustrated being up here. I feel like there's so many smart minds that have been working on this forever, and why haven't we gotten there yet? Anyway, so I'm going to tell you really briefly about our New England Asthma Innovations Collaborative. Just really, it's a project where we're working with 9 healthcare providers. We've served 1,145 patients over the last 2.5 years. We have policy and training partners. We've engaged, I'm using my rapid fingers, 7 Medicaid payers, both MCOs and state Medicaid offices, and basically doing asthma home visiting, 3 to 4 asthma home visits to go into education, provide supplies, and all this stuff that I actually have here that we're talking about already. So I'm really not going to go into the details. It's for Medicaid kids on Medicaid and CHIP. I have a lizard up there. I know Jim's talking about community health workers. I just thought this is a really good story about why community health workers, which we are promoting community health workers, is about cultural competency. And one of our community health workers told a story that she had gone to see a family and she was doing motivational interviewing. And the family was like, we're not going to do the medication stuff. We're going back to Haiti. We're going to get lizard blood. Lizard blood's going to make our kid healthy. And so the community health worker, who herself was Haitian, thought, I'm not going to talk her out of this. So I'm going to let her go back to Haiti with her kid. She went back to Haiti with her kid, came back. She said, so how'd that work out? She said, not really. And so then the family was really ready to move forward and to think about different ways that they could help their child through learning about the asthma, how asthma was affected, impacting their home. I think that's a really good story about how community health workers can be really effective. Anyway, so I just want to say that we invited payers as partners before we applied for this grant. We asked them, and maybe here's some, we asked them as soon as we knew that we were applying for this grant, we started talking to payers about how can you join our initiative. We reached out to the senior medical directors, to QI people. We told them what our problem was, what our goal was. We emphasized the benefits to them. These are my recommendations to you as well, is really that we could reach some of these things we learned after the fact. That we can reach their hardest to reach members, that we can get into their homes, we can engage them. And when I say we, I'm talking about our providers, that we can build capacity to do this intervention in their different service areas, that it may complement the work that they're trying to do with their own case management services, that they'll get data on their health outcomes. We actually are doing economic evaluation as well as an evaluation of data that we're collecting during the home visit. They'll also get data about the quality of life for their patients' caregivers as well as cost. And they also get recognition for stepping up to the plate and doing good work. I have 2 minutes left. So basically we asked them to come to meetings, to provide claims data, to provide referrals, to commit to pay for a pilot testing new payment models, and with return on investment to consider policy change. We went through a whole process. If anyone wants to talk to me at lunch about how to secure claims data, we're still in the process. It's really challenging. There's a lot of work that needs to be done on a consistent basis. I don't have time to talk about it now, but I'm happy to talk to you about it at lunch. We had a summit in 2015 where we provided data back to the payers, talking about our findings, talking about payment models, giving a caregiver perspective, and talking about how to sustain these initiatives. We actually also attended the CMS meeting in DC or Baltimore, I forget, and brought some payers with us. And our providers said that they thought that the bringing together these payers and talking about this evidence was really important, that it helped to promote further conversations, to be another bridge in the road. We know that there's challenges. One of our challenges is that we do not have our economic evaluation done yet, and our initiative was done being paid in June. Some of our sites are continuing with sustainability. Others have had to shut down their programs, of famous stories. Some of the other challenges are that with, you're talking to a senior Medicaid director, that person leaves, a new person comes, they have new priorities, and so that you're constantly re-educating people and trying to figure out what their angles are. Actually, some of the Medicaid payers are paying national organizations to come in and do case managed via telephone, and one of our sites actually is in conversations right now with a Medicaid payer in Rhode Island, where they're getting, they're this close to actually getting payment for another pilot program. We know that we're in a changing healthcare system, and that's really challenging as we're moving from a fee-for-service to a bundled payment or global payment or ACOs. And that the fact that ACOs, particularly for pediatrics, are still a few years off. Okay, I just want to say that there's lots of different kinds of opportunities. There's flexibility, there's new CMS rulings, there's community benefits. There's lots of different angles to go at this from, and I'm happy to talk to you at lunch if you're interested in this topic. Thank you.